Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Thursday, June the 18th, and we are here with our COVID-19 briefing. We are now coming to the end of the 15th week that we have been living with COVID-19 here in Montgomery County, and we are coming to the end of our second week in the yellow phase. Since our June 17th press release, we have 25 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 7,917. These positive cases are a result of a positive test for the virus, not from the antibody test. We had 5 of these cases from long-term care facilities and 20 from the community. These positive individuals are from 16 municipalities. We remain at 61 of our 62 municipalities home to individuals with COVID-19. These individuals range in age from 11 years old to 96 years old. And as always, you can take a look at our county municipal map at montcopa.org/COVID-19 for updated information. Today, we have 13 females and 12 males. One is known to be at home in isolation, and we do not have information on the rest. I'm also saddened to confirm that 2 more Montgomery County residents have lost their lives to COVID-19, which brings us to 780 deaths confirmed positive from COVID-19 in Montgomery County. Today's deaths were ranged from June the 4th to June the 17th. 1 died in a hospital and 1 died in a long-term care facility. Age range was 63 to 74. Overall, 410 females and 370 males have lost their lives to COVID-19 here in the county. In terms of racial breakdown, as we have it, we have 18 Asians, 3 Asian Indian, 3 Asian Korean, 94 African American or Black, 294 white, and 368 unknown. In terms of probable deaths, and as a reminder, these are deaths that have COVID-19 listed as a cause of death, but individuals for whom do not have laboratory confirmation that they had the coronavirus. We have 88 of those. So added to our 780 confirmed positives, that gives us a total of 868. As always, if we do get confirming lab evidence that these individuals had the coronavirus, then we will move them to the positive column. In our long-term care facility, we are now up to a total of 652 confirmed positive deaths of the 780 total. So that is 84% of the confirmed positive deaths in Montgomery County associated with a long-term care facility. I do want to just remind you that we have a new feature on our municipal map at our website, at our COVID-19 website. You can now select from a pull-down list any of our municipalities in the county. Once selected, you can see the case count for the past 7 days or the past 14 days and see how that compares to the case count for the prior 7 days or the prior 14 days. So it just gives you a sense of how things are going in a particular municipality that you might be interested in. In terms of hospital beds today, we are holding steady. We've been on a nice decrease there for a number of days, but we're now holding steady at approximately 100 people hospitalized in a Montgomery County hospital with COVID-19. And again, remaining about 25% of those individuals require a ventilator. We continue to have a stable situation at the Montgomery County Correctional Facility. All inmates who have tested positive remain symptom-free and in stable condition. Just my weekly update on the numbers at the correctional facility. Since the President Judge issued the initial March 12th, 2020 order declaring a judicial emergency, the population at the Montgomery County Correctional Facility has gone from 1,342 inmates to 824 today, a net decrease of 518, which is a 38.6% decrease. Since March the 13th, there have been a total of 1,170 discharges, and the average number of daily commits is now 3 to 4 per day, compared with 28 per day before March the 12th. I have an announcement about our community testing sites. All of our county testing sites, so that would be the drive-through at the community college and the walk-up sites in Norristown and Pottstown, will be closed tomorrow, Friday, June 19th, in observance of Juneteenth, which is being officially recognized by Montgomery County this year. All 3 sites will also be closed over the weekend. Beginning Monday, any person who needs or wants to be tested for COVID-19 is welcome at any of our county testing sites. As a reminder, these sites are no cost. They do not require a healthcare provider's order. We will test individuals of any age and for any reason. You don't need to be having symptoms. You don't need to know that you've been exposed. If you're going to visit maybe a grandparent or an older person and you just want to make sure that you are virus-free, you are welcome to be tested. Our Pottstown site, it will be open Monday through Friday, weather permitting, from 11 to 1. That site is at 364 King Street in Pottstown. And you can call the morning of the day that you would like to be tested, beginning at 8:30 in the morning. The number for Pottstown is 610-970-2937. In Norristown, also a walk-up site, open Monday through Friday, 11 to 1, permitting. You can also call the morning that you would like to be tested, and beginning at 8:30. That number is 610-592-0680. And the Norristown site is located at the Delaware Valley Community Health Center at 1401 DeKalb Street in Norristown. Both Norristown and Pottstown do have Spanish-speaking operators available. Then our drive-through site at the Montgomery County Community College in Whitpain will open again on Monday. And you can make an appointment there starting at 8 a.m. on Monday by going to moncopa.org/COVID-19, clicking on the green County Testing Information button, or you can call, also beginning at 8 a.m., 610-631-3000. From the dates inclusive of April the 16th to June the 12th, we have now tested 9,841 individuals at our community testing sites, and we have received the results on 9,690, which is 98% of that total. 1,269 of these individuals have tested positive. So for these 48 days of testing, we are running overall 13% positive. So we're really starting to see that number come down. And very importantly, for the last 14 days of testing, we're running a positivity rate of 11%. So that's just at our county testing sites. That does not include hospitals or other locations. So again, just another reminder, all 3 of those sites will be closed Friday, Saturday, and Sunday, and open again on Monday. But there are additional sites available if you need to be tested during this time period. Both CVS and Rite Aid are offering no-cost testing at a number of different locations around the county. You do have to be 18 years of age or older, but you can get more information about that also at our website under the County Testing Information button. So as a reminder, you know we've begun to open our county parks, which is really great news. We started on a tiered reopening that began on June the 8th, and we are using guidance based on CDC and also the Pennsylvania Recreation and Parks Society. We've now opened Norristown Farm Park, Lock 60, Green Lane Park, including fishing and boating there, the Upper Schuylkill Valley Park, and the Central Perkiomen Valley Park. You can go to moncopa.org/parks for additional details about which facilities are open within each park. I do want to emphasize that all park users must comply with all social distancing markers at each park, and that while you don't have to have a mask or face covering on while you're enjoying the park with just your household contacts, we are asking you to have a mask or a face covering in person so that you can quickly cover your nose and mouth if you are near others who are not part of your household. Taking these steps will allow us to keep our parks open and safe for anyone who would like to use them. Assuming that everything continues to go smoothly, we are planning to open Lorimer Park and Lower Perkiomen Valley Park on Monday, June the 22nd, but those two parks will not be open this weekend. So, as another reminder, as you know, we entered the yellow phase on Friday, June the 5th, and our goal is a responsible reopen. And we have many, many small businesses that are working so hard to responsibly reopen. And I want to ask you to please patronize our local small business owners. They have been at great financial sacrifice, real heroes in this fight, because they have closed down and many of them been closed this entire time. So I really hope that our community can come together, patronize these businesses who are so eager and anxious to get their doors open and get back on their feet. For those that are maybe for health reasons or other reasons aren't quite comfortable going out to shop just yet, I do want to remind you about our Monco Strong Small Business Gift Card Network, where you can purchase a gift card right now, so those businesses that are participating get revenue right now, and then you can use that gift card whenever you feel comfortable and ready to go back out again. So to find those gift cards, go to our moncopa.org/COVID-19 website. Scroll down about halfway down that page to where it says businesses and workers. And you'll see a bunch of green buttons underneath of that businesses and workers title. And one of those green buttons says Monco Strong Small Business Gift Card Network. And click on that and you'll see quite a few businesses in our county that are offering gift cards. So now that brings us to a quick update on how we're doing here at the county. So today we have two graphs for you. This first one you've seen every Friday or Thursday for the last number of weeks. This is our chart, our graph of the daily number of positive cases represented by those gray bars in the background and the running averages by date of test. So the red lines are the total number of positive cases in the county. The blue lines are individuals that are in the community, and the yellow-orange lines are the cases from our long-term care facilities. So you can see that these lines are absolutely trending in exactly the kind of direction that we would want, and our goal is to keep them going in this direction. So just to put some numbers on these lines, I'm going to review where we are in terms of our 7-day running averages, and these are by the date that the test was conducted. So to put this in perspective, today's graph goes through June the 13th. So comparing a week before that, which is June the 6th to June the 13th, on June the 6th, our total 7-day running average of cases was 43.3. On June the 13th, it is down to 31.9. When we look at cases from the community, we were at 36.6 for the 7-day running average on June the 6th. Now we're down to 28.4. And for the long-term care facilities, 6.6 cases on June the 6th, and now we're down to 3.4. So we are really pleased to see the decrease in these numbers, particularly in those long-term care facilities, which, as we all know, were faced with such a challenging situation. I really want to commend the staff and the residents at those facilities and appreciate their willingness to invite the county in and let us assist. And clearly, that cooperative effort has had a really, really great outcome. Now, our second graph is one that you haven't seen before, and this represents an effort to put together the total number of tests conducted on Montgomery County residents each day. And that is represented by the orange line. Now, this is an approximate total. We have not gone through the exercise of reconfirming every single address in this data set, but we believe that this is very, very close to the actual numbers of tests conducted on Montgomery County residents each day. You can see that that orange line goes up and down. Most of those dips are weekend days where many, many fewer people are tested. This total includes not only our county testing sites, but sites done at any hospital, any pharmacy, just basically any place where that a Montgomery County resident could get a test. And then the blue line is the 14-day PCR, so that's the test for the virus. And by the way, the orange line is also the virus test. This is the 14-day positivity rate of daily virus tests performed. And you can see that this blue line has been steadily coming down, and that we are now down to around 8%, which is just tremendous. Because getting down below 10% was one of the metrics, or is one of the metrics, that the Pennsylvania Department of Health and the governor are looking at for us to be able to go to green. So we are really pleased to see that our numbers are so strongly moving in the right direction. So as we move forward, I want to reiterate a couple of things. Number one, it's really important that people continue to be tested, whether you think that you need to be tested, maybe you are concerned that you had an exposure or you had some symptoms, or if you just want to be tested because you're going to visit someone with some medical problems, or you just want to be tested. We want people to get tested, and we encourage people to get tested. The more people that get tested, the better a handle we're going to have on what is happening here in our Montgomery County community, and the greater the chances are that we will be able to very quickly isolate any disease outbreak that might come up in our county. These disease outbreaks are bound to happen. This virus is not gone. And so we really want to make sure that we can quickly get a handle on any outbreaks that start to bubble up. If you do test positive, please cooperate with contact tracing. This is so critically important that we isolate any individuals that do test positive, and we have a lot of assistance to help people who need help to safely isolate, including no-cost place to stay if an individual can't isolate safely in their own home, and many other types of assistance. So please, let us know if you need help with that. But we really also need to know about contacts so that we can get those individuals into quarantine, and we can also help those individuals quarantine safely. And that is how we will keep these disease outbreaks small and contained. Think about how you're going with this virus for the foreseeable future. It will be many, many months before we have a vaccine, and some months after that before there is enough vaccine that enough of us can be vaccinated to really convey some safety in the community. So here's some ways to think about in your own personal life about your risk from the virus and what you can do to help keep yourself safe. So first of all, what are your risk factors for serious disease should you catch the coronavirus? So we know now that age over 70 is definitely higher risk population, and age between 50 and 70 is a moderate risk, and below 50 is a lower risk. However, if you have underlying medical conditions, regardless of your age, then that can increase your risk quite a bit, particularly if you have any kind of lung disease, asthma, or chronic bronchitis or COPD, if you have diabetes, or if you have any other conditions that would depress your immune system. So kind of regardless of your age, those types of diseases increase your risk. Then if you're deciding what kind of activities to do, think about it this way. If the activity is outside, that's definitely safer than being inside. Activities that involve loud speaking, intense physical activity like a group exercise class, or singing, anything that really gets people exhaling strongly, those types of activities are higher risk activities. So if you are a person who is at high risk, those are activities that you may want to consider avoiding. The other thing to consider is how long. What is the duration of the exposure within that activity? So, for instance, living in a house with somebody who's positive is a much riskier situation than if you happen to just walk by somebody on the street for a few seconds who is positive. So, duration of exposure, the longer the duration, of course, the higher the risk. And then finally, think about distance. How physically distant can you be during the activity? So obviously we want to be at least 6 feet apart from people that are not household contacts. And then will the people participating in the activity be wearing a mask? Because every day now, and for the last number of days, several different very, very good studies that have been published in the scientific literature documenting that even wearing cloth masks can make a big difference if both people are wearing them in the amount of spread of COVID-19. So those are all factors to think about if you are considering an activity or wondering if it's safe or wondering how to make it as safe as possible. And I hope that if we can all start to incorporate this guidance into our daily lives, wear masks, even if you're young and healthy, wear that mask because you are protecting other members in our community who might have a medical condition, who need to get out and go to the grocery store or run errands. We just don't know. So for the safety of everybody, just if you're out in public, please wear that mask. So with that, that concludes my remarks, and I will be happy to take any questions.
Thanks, Commissioner. This afternoon, we're joined by Jim Elwert from KYW. Jim?
Do you expect that the governor will announce Montgomery County will move to green next week?
I anticipate that tomorrow afternoon, as has been his practice, that the governor will announce new counties that will be going to green the following Friday. And I do anticipate that Montgomery County will be on that list. So if that does indeed come to pass, then he would be announcing that we'll go to green next Friday, June the 26th.
Philadelphia announced today that July 3rd. Does that change your thoughts on that, or does that affect your optimism in any way?
Jim, I'm sorry. Could you repeat that? Because there was some noise. I didn't quite hear the whole question. I missed the first part. Something about Philadelphia.
Yeah, Philadelphia today said July 3rd is the earliest they would go green. And throughout this, you've talked about going as a region and operating as a region. Does that affect your optimism in any way?
Yes, I am aware that Philadelphia is taking that step. So it certainly is a note of concern. And as given the number of people who travel back and forth between Philadelphia and Montgomery County for their work. So, I think that it won't impact Montgomery County going to green at this point. Our numbers are in a really solid place. We have contact tracing very much up and running. We can trace up to 100 people a day if we need to at this point. We have capacity in our hospitals, and all these other things are in place. And so I'm comfortable with Montgomery County going to green in a week. And I think that in terms of the back and forth between Montgomery County and Philadelphia, I think everyone's being very respectful about a slow phase in for people coming back to work. Even here at the county, we're not going to have everybody back in the office when we go to green. Green is not go back to normal. Green is go back to our new normal, or go forward, I guess I should say, to our new normal. And that means that you don't necessarily have an office full of people. that people are working some from home and some in the office, and we do that in a phased way. So I think as long as we encourage just a continued slow reopening, that we can work with Philadelphia and manage that situation and keep everybody in our region safe.
And out of curiosity, I don't know if you know this, but previously you'd said that the testing scheduling fills up pretty quickly. Do you know if that's still the case? Is it fill up right away, or do you have any idea on that?
Yeah, so in terms of our county testing sites, we have had capacity that was not used most days in the last week to 10 days. So we again would urge people to come get tested. If you're thinking about going back to work in person and just want to be tested before you go, or if there's groups of employees that want to be tested, things like that, we do have capacity right now, and we would love for people to use it, because the more people that get tested, the better sense that we have of the true prevalence of the virus in our community. So there is space, and we would love for people to get tested.
That's it for me. Thanks.
Thank you, Jim. Any other questions?
There are no further questions.
Okay, terrific. Well, everyone have a safe weekend, and we will see you next week.